Good morning, everybody, and welcome back to your Lunch Break Live. My name is Ivana Harinkyu. If you are new here, if you're not, thanks for coming back. And today I've got a very special guest. I have our own Alabama State Health Officer, Dr. Scott Harris, here to answer some of our questions that I know we have all been thinking about. And we've kind of been getting more questions as we get closer to this vaccine rollout. Dr. Harris spoke yesterday at a press conference with Alabama Governor Kay Ivey, talked about a little bit of preliminary information leading into that vaccine rollout. He said yesterday, we're hoping in Alabama to get some of those vaccines maybe by next week. We don't have them yet, but they're coming. So I've got a lot of questions for you, Doctor. We'll get right into it. And if any of you have good questions, please leave them in the comments. Let me know, and I will make sure to ask Dr. Scott Harris. But before we get quite there, Doctor, let me bring something to everybody's attention, and that is our unfortunate death rate right now in Alabama. Now, as of today, we have reached over 4,000 Alabamians who have died from the coronavirus. Now, that's 400 Alabamians since March who have died from COVID, and there are more than 450 of those deaths were just reported this month. That is a terrifying number, Doctor, and those are 4,000 people who would probably be here if we had not had coronavirus at this point. So, Doctor, what can you say about our death rate that is climbing in Alabama? And did you think we would get to these numbers just in 1 year?
I think we were always afraid we were going to get to these numbers. That seemed to be kind of a worst case scenario. If you remember what the world looked like back in April, if we can even remember back that far, we saw all these pictures in New York City. And we saw these things that were happening in places like Italy and in Spain. And it was kind of mind boggling, but it really was far off and seemed like it was far off. And we just thought, surely we're never going to have that situation. We hoped that, we're a big rural state. We don't have the same population density. Maybe that'll never happen here. Well, we were mistaken about that. It has happened here. We have lost almost 4,000 of our family members and friends and loved ones. I think everybody who knows anything about COVID knows somebody who's had it, but I think most of us probably now know somebody who's died from it as well. I certainly do. I know multiple people who've passed away from this disease, and most people now have that as part of their personal experience. So we actually track in public health, deaths of all causes. We're the agency that, records death certificates, and we can follow, who dies from what and how many and so on. We're way ahead of the number of deaths we would normally see in a year. And COVID is the reason, so these aren't people who are old and sick and might have died from something anyway. These are excess numbers of people who've died. So that's ultimately what we're trying to prevent. Every one of those deaths is not some statistic. It's somebody's mom or dad or grandparent, or child. I mean, it's one of our fellow citizens in Alabama, and that's what we're here to try to do in public health. And that's what we're trying to get everyone else to understand and cooperate with us on.
And just a note on that, we've got 4,034 Alabamians as of this morning who have died. And that, for reference, there were less than 1,300 Alabamians who died of flu and pneumonia combined in 2018. So everybody here knows, Dr. Harris, I'm not very good at math, but that's about 3 times that number. And again, 1,300 Alabamians died of flu and pneumonia combined in the year 2018. So a large increase there for COVID. Now, this is a question that I'm sure you have heard before, Doctor, but that is, our case numbers have risen over the past couple of months. There is no denying that when looking at the numbers. But Alabama does have a mask ordinance. So we do have to address that question of, are masks working? And if they are, then why are our numbers going up?
Yeah, I think they absolutely are working. And, you never can say with certainty what didn't happen, of course. But I think we've always, recognized masks aren't magic. It's not that you put on a mask and you're no longer at risk for anything. The best experience we have here in the state is that when the mask mandate was first put in place by the governor in July, it took about 2 weeks, and that's when the numbers went down, and they stayed down for 2.5 months after that. Once fall got here, we started seeing more gatherings. Schools are back, sporting events are back, businesses are back fully open in most cases. We have more people who are just tired of the whole thing and want to resume their normal activity. Me too. I feel the same way about that. And so that's when we began to see numbers go up. Listen, there's no serious debate about masks anymore. Every public health agency in the world, literally, every medical professional, public health person, scientist, researcher, they all agree that this makes sense to wear a mask, and we need people to continue to do that. I guess I can't prove to you what the numbers would be like if we stopped wearing a mask, but my medical expertise tells me they'd be a lot worse than we are.
Now, what about the places that do not enforce a mask ordinance? We do see sometimes people in stores not wearing masks. Do you think that it is up to a business to say, look, you can't come in unless you're wearing a mask?
Well, we hope that they would do the right thing to protect people in their stores. I mean, again, nobody wants to have law enforcement involved with a mask order. That is not what it's all about. What it's about is getting people to do the right thing. If businesses don't want to do the right thing, I'm not going to, be there knocking on their door to do anything about it. But we want people to understand that you wear a mask to protect other people. It's our responsibility as citizens of our state to try to be kind to other people. We don't want to do things that put other people at risk. So I would say most businesses do the right thing, or at least most of the time. And we don't want them to be in a position of having to be the law enforcement people either. But masks serve as a powerful social signal. They remind people what's going on. It's still weird to walk in a room and everybody's masked up. We're not used to that. And it gives you just a split second of grabbing your attention. And that's why wearing masks is so important. It does protect other people, but it reminds other people to protect themselves and others as well.
I think we've probably all had that moment where just kind of in maybe pre-March thinking, you maybe go to the grocery store, you get out of your car, you walk to the door and you say, oh, shoot. And you have to go back to your car and get it. But like you said, that is that reminder. I know I've done it where I get there and it's not for not intending to wear one. It's just that moment where you just forget and then you look around and it reminds you. But I'm glad you mentioned businesses, because question here, and somebody in our comments, I think Tina kind of alluded to it, and this was a question I got on Twitter, and this question is, do you agree with the governor that there are no additional changes to businesses, specifically shutdowns, maybe closing bars, et cetera, that are needed to combat these rising COVID numbers?
I think that the rules that are in place now are adequate if we can only get people to do them, and that's really been the hard part. Governor Ivey's been extremely supportive of what we're trying to do. She, frankly, has the hardest job that anybody could have. She's trying to balance all these different business concerns as well as public health concerns. They shouldn't always be competing. I think both of them can work together. But frankly, her responsibility is not only the health of individual people, but it's the economic health of the state. So I would just say there's not an easy solution to that. We can all, imagine what the state would look like if we did this or did that. I think she's done a tremendous job leading us and trying to balance all those things. And, frankly, there's 51 different plans in America because nobody really knows exactly what the perfect course is to follow.
You talk about plans. Let's pivot a little bit to talking about vaccines. I know we don't have them in Alabama yet. We are expecting them next week, our first doses. And we know those are going to go to our frontline healthcare workers that need it the most, that deserve it the most. And we are so thankful for them and for what they do. Questions on that in a second. But first, let me ask you about something that is a glaring question. And that is that so many people are not trusting of this vaccine. We have seen misinformation spreading, especially on social media, that maybe fuel some of these people's concerns. And what do you think can be done especially by Alabama's leaders, to show people that the vaccine is safe and that they should take it?
Yeah, that's a really complicated question that we've spent a lot of time thinking about. And I think in order to get to the answer to that, you have to realize there's more than one answer to that. And what I mean is there are people who are hesitant to take the vaccine, but it's for all kinds of different reasons. And many of them make really good sense. And so there's not just one single, ad campaign or one single public statement that's going to change the minds of everyone. So certainly we have people out there who just mistrust vaccines and they're in that the anti-vaxxer group, and those folks are difficult to convince, and I don't think anyone's going to convince them. But that's not most of the people who are hesitant about taking the vaccine. Many people just have concerns because they say, hey, this is a new technology. It happened really fast. And, I just want to be sure before I recommend my kids or my parents or whatever take the vaccine. That is normal. I mean, that's a really smart person thinking. And so the way we address that with those people is to try to explain to them what we understand about the safety studies that have been done with this, how they followed this normal safety protocols they have. Yeah, and I'll be really glad to talk more about that. But I'll just say in brief, the safety part of this vaccine development is the part that hasn't gone fast. That's the part that they've done exactly like they should and exactly the way they always do it. And so we feel very comfortable about that. But then you have other groups of people who aren't sure about the vaccine because they're just not sure about the political process that was playing out when we were all following this in the news. It's an election year. Everything is partisan. When a government agency that's appointed by, one political party is making these statements, you have people in the other political party who go, I don't really trust what's going on there. I think the fact that the election is behind us now helps a lot of that. But again, the questions that people had were really normal, appropriate questions to be asked. And so I certainly understand that. I think there's a group of people who mistrust the system in general. And I think, in a state like Alabama, we have, a race history that's pretty checkered, which is an understatement. We're the state that was known for the Tuskegee syphilis experiment, and everybody knows that history. Certainly every Black Alabamian knows that story. And so I think there are Black Alabamians who look at this process and go, we're not always sure we can believe what, the state of Alabama tells us or what public health tells us. And, that's a really appropriate thing for them to ask. I totally agree with that, with them asking those questions. So we are working with officials and figures in the African-American community through communities of faith and pastor organizations, through the League of Black Mayors, through African-American legislators. We're trying to find trusted voices in those communities who we can communicate with and explain why we think this is the right thing to do and why people want to take it. And we're going to allow them to carry that message to their own communities, to their own constituents, and sort of serve to validate what we're trying to say. So that was a really long answer, but I would just say hesitancy for vaccine is for a whole lot of different reasons, and there's a whole lot of different approaches you have to take to try to address it.
It's interesting you bring that up because of Alabama's past and the terrible things that have come out of the Tuskegee experiment and other things that Black Alabamians maybe think about when considering the vaccine. I had a Black Alabamian, a woman named Kira Fontenot, on last week who was participating in a vaccine trial, and she was very passionate about that and getting that word out to her community. So I'll direct everybody, if you want to know more about that, go back and watch that video. But we talk about these vaccines. You talk about getting into maybe some faith leaders and communities. And one of my questions was, we're seeing many former presidents, even several who have said they will go out in public, get their vaccine live, whatever it takes to convince people that this vaccine is safe and that it should be taken by the majority of people. Do you think there are certain people like that in Alabama? You mentioned maybe faith leaders. Are there football coaches, faith leaders, university officials? Are there other people that come to mind to you that you would like to work with so they can get their vaccine maybe either live or somehow broadcast to spread that message?
Yes, absolutely. We recognize that's a great idea. Having someone who's well known and who has credibility and who reaches certain communities that maybe just a state agency is not going to normally be able to reach. Those are exactly the people that we want to stand up and tell the truth about what they think about the vaccine. Our view is that assuming these vaccines get through the FDA process, assuming they get recommendations from the council that advises the CDC on that, the ACIP. Once it gets through those steps, we're confident that this will be safe and effective and that people ought to take it. But we have to convince other people of that. And so using these people that are a lot better known than us, who can reach a lot more people than us, is a really powerful way to do that. I've had, I will say, a number of public officials who've already reached out to us and volunteered to do that. And we are going to consider how to do that. We obviously don't want to divert vaccine from those frontline people who need it the most, from those healthcare workers and those residents of nursing homes. But I think, in small numbers, hopefully we can find some people who are willing to do it and who will help us advertise what we're trying to do.
Want to quickly address a few people. We've got Tina in our comments saying she's got COVID. We're thinking of you, Tina. Hope you get better. Hope you are improving every day. We're thinking about you. And we also have here comments from our friend Victor. He says, Dr. Harris, thank you for your service. I do realize that your job is not easy. We've also got Adam reminding everybody to download that Guide Safe exposure notification app as well with these rising case numbers. So a lot of people really giving us some interesting things to think about here in our comments. But I have a vaccine question for you, doctor, and this is from John. And John says, question for you. An opinion writer with the New York Times wrote this past weekend that plans for vaccinations from Ohio, West Virginia, and Alabama, quote, contain few details compared with those of states like California and Maryland, end quote. Do you agree with that assessment? And do you believe that the overall plan Alabama has enough adequate details?
Yeah, I think our plan does have enough adequate details. I haven't reviewed those plans from those other states that were mentioned. I would say there are states that have a lot more resources than us who are able to have a much more centralized control over what they do. States in the Northeast, for example, that are predominantly urban have many unique challenges, but they have a lot more simple path to get vaccine out than those who live in really big rural states like Alabama. So like a lot of things in Alabama, we work by cooperating with our partners and getting other people to help. And a whole lot of what we're doing with our vaccine plan involves working alongside folks from the hospital association, from provider groups like the Medical Association and the Family Practice Association, through the Nursing Home Association, through the Primary Health Care Association, the Federally Qualified Health Centers. All of these groups are really important parts of our plan, and they are coming to the table and volunteering to do at no cost many of the things that I think wealthier states could probably just, write a check to do using, government services in some cases. So we have a very good plan to get it out. We're confident that it'll be ready to go as soon as we receive the vaccine. The plans themselves have always been draft plans, and they're always in stages of redevelopment. And the only plan I'm aware of that's published on the CDC website, at least, is the one that we came up with in early October, which was essentially the template that was supplied to us. So there are many, many, many more details that have arisen since then.
So you talk about that plan. That preliminary plan released by the Alabama Department of Public Health was, I believe, on November 6th, that preliminary plan. Early November, we will say, if I'm off on the date. And there is a list in there of some of our groups of people that will be in line to get that vaccine. We know healthcare workers, our frontline healthcare workers are number one, along with our nursing home residents. So I wanted to know if you could talk about a few of those groups. And also, I think there's a concern. One of those groups is people, and I don't think that I have the exact wording, but it was people incarcerated and people in different correctional facilities, and they are above the general population for getting the vaccine. Can you talk a little bit about that?
Sure. So I will say that the information from that iteration of the plan has evolved, as well as we've gotten additional guidance from groups like the ACIP. So at the press conference that was done yesterday, we talked a little bit about the specific risk categories, and we actually have that available on our website for anyone who wants to look at it. But that plan has evolved even since the copy of the plan you're talking about. Our primary number one priority includes people who are at high risk because of what they do every day, because of their profession, or people who are at high risk because of their own underlying medical issues or vulnerability because of age. And so we're thinking of frontline healthcare workers. That includes people who work in hospitals, people who work in outpatient clinics, or who work in public health, people who work in nursing homes, people who are at risk of exposure to the disease, because even those people who are young and healthy have the ability, unfortunately, to transmit it to people who are not. And so they're at the top of our list, along with our people who are in skilled nursing facilities. If you're an older person at home with chronic illness, you're also at very high risk, and we want to get to you as soon as possible. But the risk of a spread is so much greater in a congregate facility, a facility where you have lots of people sharing a small space, that we're going to get to those people first. Unfortunately, there's not enough vaccine to go around right now for those groups, but those are our number one groups. The next group of people that we're going to get to are going to include people who are essential workers. And so there are a lot of ways to define that. I don't even like the term essential workers because it's, no one's a non-essential worker if they're working. But about half, more than half of our economy, more than half of our workforce are involved in jobs that are important just to keeping society running. So, these are people who work in manufacturing plants. These are people that work in education, like our teachers. These are people that, work in other functions like that. And that's going to be the largest group of our next group. But we also are going to prioritize any groups of people who are living together in close spaces. So there are people that are in assisted living facilities and certain types of specialty care facilities, group homes, mental health homes, people who have that ability to spread disease because they're packed together closely, or people that are going to be included in that next group as well. And that does include people in corrections. The people in corrections are, Alabamians who are going to get sick and go to the hospital and take up medical resources and need to be taken care of. And so because they're in an environment where disease can be spread easily, we want to make sure that we're keeping that from happening as well.
I know you mentioned yesterday at that press conference that it is so difficult to try to prioritize people in groups of people of who gets this vaccine first. I've got a question here from Dana, and I think that we probably have a lot of people thinking this. Dana says, I got a liver transplant back in 2016. Will I be one of the people in one of those first groups getting the shot?
Yeah, so we're trying to figure that out at the moment. The very first group, again, are going to be our frontline healthcare workers and the people who are residing in skilled nursing facilities. As we move to the next group of people, like the essential workers and others, we also are going to include those high-risk adults who have other medical problems as well, but aren't necessarily in one of those first two groups. So we need guidance from FDA and ACIP to be able to answer her question. And specifically, what that comes down to is how many organ transplant patients were in the study where these vaccines were tested, these phase 3 trials. And if they had a large number of them, they may make a recommendation that says, absolutely, we want to make sure you immunize all these people that have organ transplants. But if they weren't able to recruit enough people in that study, and then that study is probably still going on, and they may say, we don't have enough information yet to recommend this for people who've had organ transplants. We know, for example, we're positive there's not going to be a recommendation to give this vaccine to children at this time. There's not going to be a recommendation to give it to women who are pregnant at this time, just because those people weren't included in the studies to begin with. Now, eventually, we'll know the right answer to that they continue to recruit people. So as soon as we have the final guidance from FDA and ACIP, we'll be able to tell people, like the person who asked that question about organ transplant recipients.
Very interesting. I have several people in my family who've gotten organ transplants, Dana, so I'll definitely have to keep up on that one. Very interesting question. I'm glad you asked. Now, along with the vaccines, there's a question here, I believe from MJ, and I think this is very interesting, and it goes back to the fact that unfortunately our hospitals are filling up. I saw a report from Jefferson County Department of Health earlier that there are very few ICU beds left, especially those for non-COVID patients. And MJ says, I'm concerned about having an allergic reaction to this virus. And he says, our area is in such a bad situation regarding hospital beds right now. If you have serious reactions to vaccines, is it safe to get that vaccine and then risk getting sick and maybe not having a place to go or having a hard time getting into a hospital?
Yeah, these are all questions we're trying to answer now. As you know, the Pfizer vaccine has been approved in at least 3 countries now, including the UK. And after the first doses were given earlier this week, Pfizer did issue a notice about allergic reactions in certain people. So the best information we have right now is that if you're someone who has had serious allergic reactions before, and I'm not talking about allergies that you get in the spring from pollen or allergies you get, from exposure to somebody's perfume or those kind of things. But if you had serious medical allergies that a physician has had to treat you for, including rashes or severe rashes or trouble breathing, then those are people that probably don't want to get the Pfizer vaccine until we get more information. Now, that said, the next product, which is the vaccine made by Moderna, is going to be available 1 week later, we believe. And so many people, most people probably don't have those serious reactions. Of those people who do, probably most of them aren't frontline healthcare workers that are going to be the priority one for the Pfizer vaccine. And even if someone is in that category, there is going to be a Moderna product probably just a week behind. And to the best of our knowledge, it's okay to use in those people.
Who is all considered as a frontline worker? Is that anybody who works in a hospital? Is that pharmacist? Or who? It's easy to just say frontline healthcare workers, but all of our people that work in healthcare are important. They're all technically working frontline, but who falls in that exact group?
Yeah, that's a terrific question. So you're exactly right. They're all important. They're all part of our healthcare infrastructure, and they all are going to be vaccinated in phase 1 is what we expect to do. However, within that group, there are subgroups, there are tiers that we have based on what your actual risk is. And so you can imagine, for example, if you're a nurse working in a COVID unit, you're not going to get more risk than that. I mean, you're at the very tip top of the list. And particularly if you're a nurse in a COVID unit and you are over 65 or you have chronic health problems, you're really at the top of the list. So that one's easy to understand. If you do procedures that generate aerosols, so like a lung specialist who's looking down into people's lungs with a scope, or intubating somebody to put them on a breathing machine, those people are going to be at very high risk, and that's easy to understand. Now, there are other people, though, who work in the hospital who maybe aren't on the COVID unit, and maybe they work on the general medical floor. Those people absolutely have risk, and we absolutely are going to get to them as soon as possible, but they're going to be a little bit lower priority than the people who we know for a fact are exposed with every single aspect of our job. Now, one other part of that to point out is just the definition of your job title is not what's going to determine what your risk is. We've encouraged all these facilities and clinics to actually think about the actual risk. So if you're a unit secretary, if you're in housekeeping, if you're working in dietary, if you're working in the respiratory department, you may also be very much at the top of that list, even though you're not a doctor or a nurse. Or, in the case of someone who's in environmental services or housekeeping, we may not even normally consider you to be a healthcare worker, but you're essential to the running of that healthcare facility, and you have risk because you're working on the same unit side by side with these doctors and nurses who are the first ones we think of when we think about risk.
You're so right. And it's important to remember too, that COVID is not just one isolated thing. You can have multiple issues. You can have a brain tumor and then also have COVID.
Yeah,
and so, that would be, that's a horrible example, but it's possible and it happens. And so that's important to note, that there could be people who maybe typically aren't working with COVID patients maybe all day, every day, but unfortunately are running into the virus while they are in that hospital environment. Now,
absolutely.
I have a question here from Anna Lynn, and she says, are you seeing data that shows mutations in COVID-19 where it could turn into different strains like we see in the flu?
Yeah, we don't have that information available for Alabama at this point. ADPH doesn't have the ability to type those type of mutations. However, that information is being collected nationally by a number of different places. We know that there are mutations in the virus, and that's, incredibly unsurprising. I mean, that's true with any type of infection, and particularly with any type of viral infection, but also with bacterial infections. You get mutations all the time, and it's just a normal aspect of nature. However, to the best of our knowledge so far, none of those mutations are significant in a clinical way. They're not making people more sick. They're not making people less sick either. They're not more likely to spread or less likely to spread. So we will continue to see mutations. What we hope is that we get this pandemic under control before we see a mutation that really makes a bad clinical difference.
Where do teachers fall on the list of people getting the vaccine?
Teachers are our essential personnel. So they're in the group immediately following our frontline healthcare workers and our nursing home residents, along with other essential workers. We understand how important it is to keep our teachers safe and healthy. They actually face, some degree of risk, if they're in, even though children themselves don't usually get as sick as adults and don't usually spread it as much. The truth is that a teacher can have a lot of exposure, and oftentimes they're in situations where it's just impossible to social distance, the way that we would like for them to. So, and teachers, are part of our adult population, and so they may be seniors or they may have chronic health problems as well. So after our frontline healthcare workers and our nursing home residents, teachers are in the very next group along with other essential workers.
Quick question here. I think you will be a quick answer from Vanessa saying, is it true that blood type O people have a lower chance of getting the virus?
Yeah, that's actually, it seems to be true. That's something that was recognized fairly early on. People with type O blood tend to not get infected as often and tend not to get as sick. People with type A blood actually are the opposite. They tend to be a little more prone to getting infected. I think we just look at that and go, that's pretty interesting. But unfortunately, there's nothing anybody can do about that. Your blood type is what it is, and so I think if you're type O, I wouldn't have a lot of comfort in that. We still want you to protect yourself and do all the things that we hope you'll do.
That's so fascinating. And then a quick question here from Diane. I'm trying to knock out some of these quick ones for you. Diane says, can you ask why we can't have a city or a zip code number for rates of infection?
Yeah, so we actually have worked on that. There are in every county, there are entities in the county that have access to that. The EMAs have that. There's certain public officials that do have that. It actually all comes down to, believe it or not, to healthcare privacy rules, and that's what it's based on. And so we can give population numbers or sort of non-identified data numbers for any large group, but when you get down to smaller and smaller groups, it actually becomes possible to actually identify people. And that's where the issue is and really has always been. It's not that it's a secret. You can do just a little bit of manipulation with the map and the data that's out there and figure out those numbers yourself. It's not that challenging to do. But if we identified, say, in a nursing home, we had 3 cases and 1 death this week. There are a lot of people in the community that know who those people are just by us saying that, and that's true for all cases, and it's true for all diseases. It's the way we treat, just about every other disease as well. We identify them by county or we identify them by large regional area, but not too specifically.
Mary, will the vaccine be mandatory?
No. Certainly not by the state of Alabama. The state doesn't mandate anybody take any vaccines. There are, employers that may consider doing that. I don't know. Excuse me. I've been doing a lot of talking today, so sorry about
I was about to say, I'll give you a second to breathe and answer a question, I think, from Elizabeth and from Lois, who asked about the cost of the vaccine. Dr. Harris said yesterday that to patients, the vaccine will be given at no cost, and that is to patients. We're not going to get into the insurance issue here. That's a ball of yarn I'm not going to unfurl myself, but it will be free to patients. Now, I have 2 more questions for you, Dr. Harris, and I know you're a busy man, but Stacy asks, is it true the vaccine will only lessen the virus and not prevent contraction of the virus?
Yeah, we don't know that, but that's quite possibly true. Or it may be that it prevents it in some people, but just lessens the seriousness of infection in others. That's definitely true with the flu vaccine. For example, the flu vaccine prevents many cases of flu from occurring. But some people can get infected with the flu anyway, and they just do a lot better. So we'll see what happens when we get more information.
And my last question for you, I think I can elaborate on the first part and let you catch your breath. And that is that we know people want to know when they're going to get the vaccine. We know those first doses will be out in the next week. We know that the Moderna vaccine, I believe, will be available maybe a week or so after that. So our kind of first doses will be rolling out before Christmas. What are we expecting in terms of the next groups, maybe our essential workers, and then going down that list from there down to general population?
I think we would love to think we got through our entire first group in a month, but it's probably not likely to happen. It's probably going to take a couple of months to do that. So I think when we start getting into the next group, it's probably going to be 2 to 3 months after we first started vaccinating people.
So we're looking at the spring.
Yeah, I think that's right. Perhaps early spring for those groups. In order to get the vaccine just to the average everyday Alabamian who's, young and healthy and not an essential worker, it's probably going to be late spring or early summer for that group.
So we're looking for, I know everybody is ready for a promising 2021 to get things back to normal. I know it's a slow road, but we are starting at the beginning of that journey and we're seeing the light at the end of the tunnel. We got to get through the light, but we're seeing it. Dr. Harris, thank you so much for your time, for breaking down all of these questions. I know we hit a lot at you and threw a lot at you, but we appreciate it.
Listen, thank you. It was really good to be with you. I appreciate all the questions, and thanks for having me today.
Thank you so much, everybody. Thank you so much for watching. We'll see you tomorrow.